So for a C-section, if you come to theatre for a C-section, when you arrive, we will ask you to shuffle onto our bed or to sit on the side of the bed if you need a spinal anaesthetic. We connect you to all our monitoring, so a blood pressure cuff on your arm, a little oxygen probe and some sticky dots for your heart. This is all routine for anyone that comes to theatre, just so that we can monitor you very closely. If you haven't already got a little drip in the back of your hand, we will put one of these in. If the epidural is working well, then you'll lay down immediately and we'll start injecting stronger medication in your back. Otherwise, we sometimes sit you or lie you sideways to do the spinal anaesthetic. While the anaesthetic is kicking in, we will explain more detail as to what's to happen, and the midwives will insert a little tube into the bladder so they drain it if you haven't already got a catheter, so that the bladder doesn't get in the way of the surgeons. Until baby is out, and all the while that you are laying down, the bed is slightly tilted. This just gets the baby bump off your tummy vessels to minimise things like feeling sick. Epidural top-ups and spinal anaesthetics do drop your blood pressure by nature of how they work. We keep a very close eye on your blood pressure every 3 minutes, but if your blood pressure drops, it makes you feel sick. Just let us know that bowl's available and we can fix it quite quickly. They often make you quite significantly shivery. This is an annoying side effect, but it's very normal and it means the epidural is working well. We go on to check the height of the anaesthetic, either using an ice stick or a cold spray. The reason we use cold is because the nerves that carry pain are the same ones that carry temperature. So if you can't feel cold, you can't feel pain. And that's one of the ways we are happy to let the surgeons operate. You won't be able to see anything of the surgery, as there will be a big sheet between us, your birthing partner, and the surgeons. We numb you right up to your nipples, just to ensure that you don't have any discomfort during the procedure. This sometimes makes you feel a bit heavy-chested or breathless. Don't worry, we constantly monitor your oxygen levels. It doesn't actually affect your breathing, it's just the sensation. Again, as I said with an epidural, anaesthetics will numb you to pain, but they do not numb you to sensation. So during a C-section, you feel lots of pushing, pulling, tugging and stretching. A lot of patients describe it like washing up in their tummy. It's just very strange, it's not painful. There are a number of checks that we do before we start surgery to ensure that we know that you're safe. In terms of the surgery itself, it normally takes about 8 to 9 minutes to get baby out and about 45 minutes to an hour to repair the surgical wound afterwards. We will always keep an eye over the top of the drapes and the big sheets to let you know which bits of the operation are going to be more tuggy. Just before baby comes out, they have to put a lot of pressure up on the left-hand side of your ribcage, just to push baby out the opening. We will look over the top, we will warn you when it happens, and just bear with us. It doesn't take too long, it's just while they push baby out the opening, but it does make you feel a little breathless, just because they're physically squishing on your chest. Don't worry if baby doesn't cry initially. C-section babies are quite often have a bit more soggy lungs than babies that get pushed out the normal way, but they will cry long term. Once the baby is out, we normally lower the drapes so that you can see baby a bit like Lion King. The surgeons will hold the baby up for you. Don't worry, you can't see anything of the surgery yourself because it's the other side of the bump. But equally, it's totally fine if you don't want them to lift baby up afterwards. You can see baby as soon as baby's been dried off on the resuscitator. If baby is okay, then the surgeons will place the baby between your legs. This is for 2 minutes, just to give the baby all the cord blood from the placenta prior to clamping the placenta and taking the baby to the resuscitator, which was in the picture previously. The midwives and the baby doctors, and they will check baby off and make sure baby's happy and make sure baby's nice and dry so they don't get cold. If baby comes out a little bit more shocked than expected, sometimes we don't wait for the cord blood and we pass the baby straight to the midwives for a little bit of extra support. This isn't uncommon with C-sections, don't worry about it. Once baby is dried and baby doctors are happy, then baby will come over to you and will lay on your chest for the rest of the operation. If at any point you feel uncomfortable or feel sick or any other concerns, just let your anaesthetist know and they will arrange for your partner to have baby